Hello, my name is Alejandra de la Garza, and I'll be presenting a training on conflict resolution plan in the UBA workspace. Our agenda for today will be the first one will be training overview, the second will be objectives, the third will be common conflicts in ABA, conflict resolution strategies and preventative measures. Number 4 is a flowchart with the conflict resolution framework, and then number 5 we're going to practice together, and then number 6 is interpersonal skills, and 7 will be a resolution checklist handout, and 8 conclusion. So an overview in the training. There is common interpersonal conflicts often arise in the clinic while providing ABA therapy. These conflicts may include staff disagreements, issues with clients' progress, and misunderstandings with families. Implementing a training program that focuses on client resolution can promote consistency in the client care, improve data integrity, and enhance team collaboration, and straighten family communication. The learning objectives are the learners will understand the common conflicts in ABA, identify specific strategies for resolution, learn the conflict resolution process, and know how to address and resolve conflicts. The first common conflict is staff disagreements, which is defined as a situation that arises from conflicting views, demands, cultural differences, or work styles among two or more people, communicate through verbal exchanges or written. The second one is issues with client's progress, which is defined as inconsistent implementation of treatment goals, ineffective interventions, and or inconsistent sessions. The third conflict is misunderstanding with families, defined as any instance during contact with a family in which they express confusion, contradicts, and provide conflicted statements or interpretations. This slide provides an overview of resolution strategies and preventative measures for each conflict. A resolution for staff disagreement is active listening and remediate, and the preventative measure is providing regular team meetings. The second conflict is the issues with client progress, and the resolution for that is identifying barriers and communicating. Preventative measure is providing a communication protocol and regular check-ins. The third one, the conflict is misunderstanding families, and the resolution is clarify intentions. And the preventative measures is providing parent training and clarifying ABA implementations. This flowchart details a conflict resolution plan for staff disagreements that could occur. It starts off with the clinic leadership, which is a PCB or a supervisor, being aware of the situation, and ending with finding a solution and provide consistency check-ins. I'll let you guys go ahead and review the flowchart. A resolution checklist handout was provided. Please feel free to review it at this moment. The conflict resolution checklist provides a debrief on how to organize the meeting by first recognizing, acknowledging the issue and your own reaction, clarifying, listening to understanding their perspective and restate the problem, collaborating by discussing solutions, and compromise by seeking common goal, and resolving, agree on a plan of action, following up and check in as needed. Remember during the meeting to maintain active listening skills by being attentive, asking open-ended questions, and request clarification, and summarize as needed. Okay, now we're going to practice as a team. First case scenario. The conflict is Tina, behavior technician, engages in stating negative statements about Judy, another behavior technician, regarding her working style. Judy becomes aware of the negative statements. What can Judy do? A. Confront Tina publicly. B. Inform direct supervisor. C. Ignore the problem. D. Tell the staff what Tina is doing. Yes, you're correct. B. Inform direct supervisor. We're continuing with the scenario. Judy informs Daisy, direct supervisor, about the situation. Daisy assesses the situation and decides to set up a meeting between both behavior technician Tina and Judy. Judy debriefs the purpose of the meeting and hands the handout to each behavior technician. What is the first step for the BTs? A. Blame each other. B. Resolve and agree on the plan of action. Recognize the issue and own reaction to negate the consequence. Yes, correct. C. Recognize the issue and own reaction. Let's continue. What is the four-step solution? Recognize, clarify, collaborate, and resolve. The following slide dive into interpersonal skills that impact the longevity and quality of one's career and support provided to others that can be seen as proactive strategies that as a team we need to implement. First one is self-care, seen as an engagement in behaviors to increase or maintain one's well-being. Second is self-awareness, which is involving internal and external traits. There is self-regulation, which is managing behaviors and private events to engage in goal-directed behaviors. These three interpersonal skills are a good point to start implementing in our daily lives because they guide us and support our implementation of treatment and working with others such as staff, caregivers. So the first is self-care. So inclusion of self-care practices are associated with perceived stress levels. By practicing self-care, we can improve relationships with staff. Self-awareness, quality of work improves. Effectively collaborating with staff and caregivers helps manage each individual's response during conversations, collaborations in the field. And the third one, self-regulation, impacts the quality of work by managing personal feelings that may arise that improve the quality of supervision and when providing services. So in conclusion, effective conflict resolution in the ABA field involves building teams comprising of caregivers, behavior technicians, supervisors, and board-certified behavior analysts that are client-centered and foster mutual respect and accountability. When conflict arises, it presents an opportunity to strengthen team dynamics and build lasting trust with families and staff. By implementing a structured approach that includes recognizing, clarifying, collaborating, and resolving, we can create a supportive and solution-focused environment. Furthermore, by developing interpersonal skills and practicing self-care, we can provide support with empathy and patience. Through self-awareness, we can recognize our emotions and triggers, and with self-regulation, we can reflect and respond thoughtfully. Thank you.